What is a therapist? A therapist is a trained professional who has received undergraduate and graduate level training. Therapists receive supervised clinical training, including hundreds of hours of education and support, specializing in meditation, helping others understand and identify feelings, support, decision making, and providing guidance for life decisions. Therapists provide valuable support to the client. Therapists are often provide individual, group, couple, or family therapy sessions for a variety of age and needs. It is the therapist's responsibility to establish the boundaries of the therapy situation. This includes a wide range of boundaries, include a safe environment. It is also the therapist's role to define what exactly is a psychotherapy. Is because what constitutes psychotherapy is different for different therapists by using different methods and define the way they practice. A major part of professional roles of the therapist is to facilitate the awareness, growth, and psychological development of the patient. Uniqueness and strength of the patient-therapist relation form and identify for therapeutic inquiry and growth. The therapist develop a relationship with the patient through activities and empathic listening, caring, and warmth. Under humanist psychological approach, it is understood that the rapport between the therapist and patient is a predictor of a successful treatment. Understanding the patient also is the treatment process. Therapy is a relationship between the patient and the therapist in which both are expected to change through their interaction in the process of the therapist. As relationship grows and development develops, the patient is expected to change and grow more than the therapist. One of the goals of the therapy is to explore the factor that may interfere with the relationship between the patient and the therapist. Thus, the therapist reminds the patient of someone he or she presents. By lying into this factor and identifying them, effective strategies can be developed to help in the healing process. Typically, the barrier of the better relationship is therapists become a microcosm of the barriers of relationship with the people outside of the therapy. A key success to the healing process is the authenticity of the therapist, being genuine and transparent in the vital to the success of the relationship. This because a reflection for the patient striving to be congruent in their interaction with the therapist, as well as striving to the congruent outside of the therapeutic situation.